afternoon, everyone! This is 5 Minutes Medicine. We're Danny and Alex, and we're recording from Gabon.
Today we're gonna be talking about multiple sclerosis. Alex, have you ever heard about this topic?
Actually, yes! We have been investigating about this disease, and we have discovered that the main cause of it is your own body.
But how can your own body kill yourself?
Well, your immunological system recognizes you as an intruder and start attacking your myelin cells.
Myelin cells?
Yeah, myelin cells are the recoverment of your axons, of your neurons, and you completely lose your mobility and coordination.
Okay, Alex, I've seen you've done your homework. Today we'll be looking for the reason why this happened and which is the actual status in biomedical research. And later we're going to talk to some doctors and with some of the real patients. Now we're going to connect with Maria Pratt and she's going to explain us what's this meant with this disease. Maria? And now we're here with Amalia Pratt, who's a student of medicine of University of Barcelona, and she's going to explain us what's multiple sclerosis. Amalia, could you explain us specifically what's multiple sclerosis and what does it cause?
Of course. Multiple sclerosis is also known as disseminated sclerosis. It's an inflammatory disease in which the insulating covers in the
cells of the brain are damaged. This damage is as a result of a reaction in the immunological system of the own sick.
Amalia, could you explain us how is exactly this immunological reaction?
This is considered as an autoimmune disease. Autoimmune system is the system that defends us from external dangers, such as bacteria or virus, recognizing it as intruders. The problem comes when, in multiple sclerosis,
this system recognizes our own system as an intruder, attacking it with the goal of deleting it from the body.
Believe that some components in myelin work as an antigen in this disease, but we don't know exactly what's the exact component.
Now we'll see an animation that will show us what exactly happens in our brains when we have multiple sclerosis. In our brain, there are lots of procedures and reactions. Myelin is a dielectric substance recovering the neurons of the axon. It's a type of glial cell, the type of cell that maintains neurons homeostasis. Myelin assures the efficiency of the impulse transmission. These cells are part of the immunological system. These cells are created to increase the immune response by recognizing the presence of a foreign antigen. These cells are able to pass across the blood-brain barrier that separates brain-blood components from the central nervous system. Once inside, T cells release proteins to activate B cells and macrophage functions. Together, these three murderers attack aggressively the axons, disintegrating all the neurons. Multiple sclerosis affects all the brain. The symptoms can be very different depending on the patient. Normally, the common symptoms are difficulty in walking, dizziness, fatigue, sexual difficulties, special vaginal dryness in women, and erection problems in men, blurring vision, eye pain, involuntary eye movements, ataxia, thinking problems, numbness, and sometimes psychopathologies.
Thank you, Amalia. That's been really interesting. And now, we have some news that Danny is in the bus swimming pool with some sclerosis multiple patients. Pay attention.
Thanks, Alex. I'm here in a bus swimming pool with some of the people that take care of multiple sclerosis patients. And now I'm going to talk with some of the staff and they are going to explain it what kind of exercise do they do for improving their mobility and coordination. Could you explain us which one is the most affected patient?
Modesto es el que más afectado está. Esto es lo que vais a ver. Él le afectó al cerebro, ¿vale? Entonces cuando afecta a un lado del cerebro, el lado contrario del cuerpo es el que está inmovilizado, ¿vale? Entonces él, ahora no recuerdo bien, pero creo que es el izquierdo el que no lo mueve, ¿vale? Y el que hay que moverle. Por eso al final de la sesión se le trabajan aductores, cuádriceps y tal, lo vamos moviendo nosotros para que no acabe atrofiándose, porque provoca una espasticidad.
What kind of exercises are you doing for improving their mobility and coordination?
Bueno, pues lo que vamos trabajando con Modesto es más o menos un poco de tonificación para los brazos y lo que es un poquito de estiramiento con su propio cuerpo para las piernas. También en el sitio trabajamos
Modesto has been treating with multiple sclerosis for more than 15 years, and now we're going to talk with him and he's going to explain us his experience. Hola, ¿cómo os llamáis?
Yo soy Modesto Díaz Martínez.
Y yo purificación ascensión.
Vale. ¿Cuándo le diagnosticaron esclerosis múltiple?
Hace ya por lo menos 15 años. 15 o 16 años.
¿Y al principio qué síntomas tenía? ¿Qué notaba?
Bueno, yo empecé que tropezaba con una pierna, con la derecha, sin haber nada en el suelo tropezaba y pues esto pasará algo. Y luego ya pues continuó, luego pasó a la otra pierna, luego al brazo y bueno, y te vas quedando inmóvil de varios sitios.
¿Y cómo se ha cambiado la vida con esclerosis múltiple?
Pues cambia totalmente, diría yo. Todo porque yo trabajaba y yo hacía vida normal y al final tuve que dejar de trabajar, tuve que todo, no puedes hacer tus faenas normalmente.
Finally, after this awesome experience, we connect with Danny, which is with a specialist in multiple sclerosis, and which will explain us something about the research that is being made right now.
And now we're here with Dr. Stephenson, who is a specialist of the research of multiple sclerosis cure. We're glad to talk with her.
Thank you, Danny. I'm glad to participate in your TV program. As everyone knows, multiple sclerosis hasn't have a developed cure yet, but there are many future expectations that give us a lot of hope.
And what are your studies based on?
Nowadays, in the National Institute of Health, are investigating the possibility to destroy the whole immunological system of the patients with chemotherapy and afterwards replace it with a stem cell coming from the patient's blood. With the investigation line, we are trying to stop the development of new injuries.
And that's interesting.
Yeah.
What's your opinion about the timings?
These are slow investigations in which we first have to carry on lots of clinical attempts, so I think it's gonna take a few years.
Okay, thank you, Dr. Stephenson. It has been really interesting.
Thank you so much. We hope you have enjoyed this video.